Okay.
Alrighty, good afternoon. This is a Board of Health update for the 16th of December. I'm told that we're having some problems streaming, so we'll keep this as a very brief update and post it to YouTube as soon as possible after the fact. So with that, Dwayne, I'd ask you to kind of lead us through what we're looking at today.
Thank you, Commissioner. Good afternoon, everyone, commissioners, staff, Elbert County citizens.
Dwayne, this is
Yes.
Sam. Let me interrupt you. We need to do a roll call and a couple things, so hang on just a second.
Okay.
Okay, Amanda, you should be able to hit your mic and.
Can you guys hear me?
Yep, we have you.
Okay. Commissioner Richardson,
Here.
Commissioner Pettit, Commissioner Thayer.
Here.
Thank you.
Alrighty. With that, Dwayne, I'd pass it on to you.
Okay. Thank you, Commissioner. Good afternoon, everyone. This will be a brief update. I want to first talk about or provide an update on the COVID-19 situation. After a high volume of cases in late October and then continuing through November and into December, I hope we're at a plateau or a little bit of a downward trend currently. Year to date, we are at 819 cases of PCR confirmed COVID-19 infections. For historical context, on the 1st of November, we had a year-to-date total of 264 cases. On the 1st of December, we had 614 cases. So that was an increase of 350 cases in November alone. And currently we're at 819 cases. I believe we have about 75 serology confirmed cases. Those are tests that indicate a past infection of the COVID virus. Our 2-week cumulative incidence rate continues to be high. It is currently 775 cases per 100,000 population, and our 2-week positivity is still high at 16.59%. Those metrics place the county in the level red severe risk category on the Colorado COVID dial. Consistent with some statewide trends in data over the past week, there have been a little bit of a decline. The anticipated uptick in cases after Thanksgiving really hasn't materialized to the extent that we feared it would, which is good news. Elbert County currently ranks, let's see. Sorry, I want to say 55th, and I know I put it in this morning's update. Yes, 55th among Colorado's 64 counties in the 7-day incidence of cases per 100,000. Colorado as a state is making a little bit of progress. In the East Central Colorado Public Health Region, which encompasses Cheyenne, Elbert, Kit Carson, and Lincoln County, currently 1 in 35 residents is infected. While that measure is the 3rd highest among Colorado's 11 public health regions, it is somewhat skewed by the very high volume of cases and rates in Lincoln County. Lincoln County currently is ranked highest in the state at 2,214 cases per 100,000 population. So they're having some challenges next door to us. Moving on to a testing opportunity, I want to make sure folks are aware that we are partnering with COVID Check Colorado, who is coming out this Friday, December 18th. They will be at Kiowa High School from 1:30 to 4:30 p.m. to offer testing to anyone that is interested in getting tested. The only exclusions are people that have had a positive COVID test in the past 90 days are not eligible for the test. Testing is free. They can find additional information on the county website or at COVID Check Colorado. We are encouraging pre-registration to get more people through the testing lines. A quick update on the vaccine rollout. First, I want to thank our Public Health Medical Officer, Dr. John Duvall, an Elbert County resident, who signed off on the necessary documents as is required to have a medical officer with a medical license and some of the other details. He did that in short order last week so that we could get officially registered to administer the vaccine when it is available. Again, we will be partnering with Tri-County Health Department. In preliminary discussions, we have discussed offering inoculations at the Elbert County Fairgrounds in Kiowa, and hopefully that comes sometime in January. As far as the vaccine distribution goes, the state has identified 3 phases of vaccine distribution. Phase 1A, which is already underway as of Monday this week. Those are the highest risk healthcare workers and individuals, including people with direct contact with COVID-19 patients, and also long-term care facility staff and residents at skilled nursing facilities. And that staff will be inoculated via contract in partnership through Walgreens and CVS. So that will not be the responsibility of local entities to cover that population. Phase 1B will be moderate risk healthcare workers and first responders. First responders meaning law enforcement, fire, EMS, even those who are doing non-critical transport of patients. Workers in home health agencies, hospice care settings, dental settings are also included in there. And then as we get closer to spring, we'll move into phase 2 of the vaccine distribution. Those will be higher risk individuals and essential workers, including people age 65 and older, people of any age with pre-existing conditions, pre-existing health conditions, people who interact directly with the public at work, such as frontline workers in grocery stores and schools, including faculty and staff in schools, people who work in high density settings like farms and meat packing plants, workers serving people that live in high density congregate care settings, other healthcare workers who were not covered in phase 1, and any adult that received a placebo during a COVID-19 vaccine clinical trial will be in phase 2. Then somewhere, hopefully early summer, hopefully not too far into summer, we'll move into phase 3 vaccine distribution. That is the general public, and that includes anyone age 18 to 64 without high-risk conditions. Folks with high-risk conditions should consult with their primary care provider to see if the vaccine is a viable option and a safe option for them. Moving on to some news on the 5-star variance program that will allow restaurants and other entities to have dine-in options that are currently not allowable under the level red designation. Thank you, Commissioner Richardson, for teeing that up and getting a conversation ready for tomorrow with restaurant owners and other officials that will most likely be involved in this program so that we can begin having conversations about what that variance program looks like. I do want to emphasize that it is going to be a heavy lift. It's going to take a fairly significant amount of coordination and delegation on the part of not only county and municipal elected officials or others, local public health, the businesses themselves, law enforcement, and other folks. So once we get that, make some further progress on what that looks like, it's important to note that the county must, to be eligible to apply to CDPHE for this variance program, the county needs to have a 2-week decline in the metrics previously mentioned, 2-week positivity and volume of cases. And I also should mention hospitalizations are in there. Thankfully, Elbert County residents are not being hospitalized in large volume or percentages, as is the case in other counties. We have experienced a little bit of an uptick in hospitalizations, but nothing that is overly concerning at this point. So that's what the variance program will look like moving forward. Many checks and balances that will be involved. Lots of communication will be necessary once we get the details ironed out. But we look forward to getting started on that so that we can get dine-in restaurants being allowed to have dine-in patrons again. That is the abbreviated version of the COVID-19 situation update at this time. I'm happy to entertain any questions on this topic or actually, I thought of one more thing. I knew there was something else. So we have had initial conversations with Peak Vista Community Health Clinic to partner with them to get a public health nurse hired. We have done a walkthrough with Peak Vista staff in our Health and Human Services building and looking at the clinic space. Commissioners, one thing of note, it looks like we'll probably need to spend in the neighborhood of $25,000 to $30,000 in upgrades to basically get the clinic space and the examination rooms up to spec for approval so that we can begin seeing patients. We have that money set aside in the public health fund. We are in good shape financially with the public health fund, and that funding is exclusive of any COVID related funds. So this is a separate funding conversation from COVID. So we met with Bobby Chevaria, our building manager, and he is in the loop in this conversation. We do need to make a couple modifications structurally to the space over there, nothing significant that will be incorporated as part of the larger human services overhaul of the building. I think Bobby said he's going to put that out for bid in early January and hopes to have it back 3 weeks later. So probably looking at a couple months out, a month and a half or two before he can get started on that with the contractor. So, and I'll stop there. Any questions I can answer or anything I can expound upon?
From my end, Dwayne, as Chris, I don't have any questions. I appreciate the update. And I guess we'll see what type of interest we have from local restaurants on pursuing the 5-star program. A couple have reached out since the message last night that intend to attend the meeting tomorrow. Hopefully we'll get a majority, but I think if this is a program that the industry themselves, the owner operators, kind of lean in and take control of, I think we can make this happen if our numbers continue in the direction they have for the last few days. Hopefully we will be postured at the end of that 2-week period of decline to request initiation of this, but looking forward to tomorrow's discussions. Anything from Grant or Rick?
I have no questions.
Oh, I'm good.
All righty, well, thank you much. I would accept a motion to adjourn.
So moved.
I'll second.
Okay, we have a motion and a second to adjourn. Dwayne, thank you very much. And Sam, if you can get this video posted as soon as possible, I'd appreciate it. All in favor of adjournment, please say aye.
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 Okay. Motion carries. We're adjourned. Thank you very much.